In this cool sculpting procedure training video, we will discuss how to use the vacuum applicator on the abdomen. Topics include how to assess the abdomen, plan the treatment with markings, place the applicator, and position the patient. Cool sculpting applicators allow you to debulk and sculpt the body. The Cool Max applicator is used to debulk the abdomen, and it is ideal for large volume reduction. The Cool Core applicator is ideal for sculpting the abdomen. The Cool Fit applicator may be used to sculpt longer, more vertical areas of fat. Use the Applicator Planning Templates to determine the preferred applicators during the assessment process. Patient selection and the assessment process are critical for consistent and aesthetically pleasing outcomes. The goal for cool sculpting treatment is to minimize the presentation of bulges and flatten the abdomen. Patients who do not have a bulge or pocket of fat in the treatment area may not be candidates for treatment. The cool sculpting procedure removes subcutaneous fat from the body. It is not a solution for deep visceral fat below the muscle wall. The cool sculpting procedure should not be used on or around an abdominal hernia. A medical provider should examine the patient for evidence of a pre-existing abdominal hernia during the consultation. Deviating from treatment protocols may cause irregular outcomes. Here's what you can expect when following the recommended treatment protocols. On the treatment day, the patient should wear disposable shorts. Document their weight and take baseline 360-degree photos using the foot positioning guide. When taking photos of the abdomen, the patient's hands should be at a 90-degree angle resting on their elbows. Assess the abdomen while the patient is standing with their weight evenly distributed. Identify the natural outline and shape of the abdomen. For female patients, look at the lower, mid, and upper abdomen during the assessment. For male patients, assess the lower and upper abdomen. Identify opportunities for debulking versus sculpting. When debulking the abdomen, set expectations with the patient that additional treatments may be needed to sculpt that area to achieve desired results. Using the C shape with your hands, pull tissue away from the body to determine how much tissue can be drawn into the vacuum applicator. Asymmetry is common in the abdomen. Discuss differences in fat distribution with the patient, as it will affect the marking and placement of the applicator. Before marking the patient, wipe the treatment area with alcohol to remove excess oil or lotion from the skin. The center of the vacuum applicator will draw and treat the greatest amount of fat, so consider centering the applicator over the peaks on the abdomen. Beginning at the lower abdomen, mark the peaks of the bulges with an X and continue to work your way up the abdomen, marking the peaks with an X. Find the natural orientation and center the applicator planning template over the peak of the bulge, following its natural orientation. Draw a line from one end of the template to the other, extending the lines on both sides. Mark the end of the template to help position the applicator angle and placement. Mark the cooling panels to identify the area that will be treated. Remove the applicator and extend the cooling panel lines. Confirm the placement of the cooling panels. Continue to work your way up the abdomen, finding the orientation and centering the template over the X. Use different colored pens to better define the treatment markings. Step away and visually assess your markings to confirm complete coverage. To prepare for placement of the applicator, seat the patient in a reclined position on the treatment bed with an absorbent pad to capture residual gel. Pick up the gel pad and gently drape it between the two cooling panel markings. Working from the center outward, use the back of your fingers to smooth the gel pad and eliminate wrinkles and air bubbles. Recommended settings for the vacuum are 60, 75, and 60. Engage the vacuum before placing on the patient. Do not rock or roll the applicator into place. Apply the applicator straight on, following the treatment markings. The patient will feel sensations of deep pulling, tugging, and pinching as the vacuum is applied. Verify that the gel pad is extended past the applicator's cooling panels and check to see if there is sufficient tissue contact with the cooling panels. To deliver therapeutic cold to the treatment area, tissue must make contact with the cooling panels. Maximum tissue exposure to the cooling panels will result in a greater opportunity for fat cell death. To loosen tissue and improve tissue draw, consider using one or more of the following techniques. Administer a manual massage to the treatment area. Apply the vacuum applicator for 3 to 5 minutes without initiating cold. Remove the applicator and gel pad, then replace with a new gel pad and reapply the applicator. Use a warm, wet washcloth over the treatment area. After tissue draw is confirmed, use pillows to support the applicator and improve the comfort of the patient. After the patient is in position, engage cooling. As the cooling begins, they may feel an intense cold, tingling, stinging, aching, and cramping. These sensations generally subside as the area becomes numb. Stay with the patient for a few minutes after cooling has initiated and check on them periodically during treatment. Immediately after cooling has ended, turn off the vacuum. Release the vacuum seal by sliding your finger between the patient's skin and the edges of the applicator cup. Remove the single-use gel pad and begin to administer a 2-minute massage. In the first minute, vigorously knead the treatment area. In the second minute, apply a deep pressure massage in a circular motion. Educate the patient on what to expect after treatment. In the days and weeks following treatment, the patient may experience redness, bruising, swelling, tenderness, cramping, and aching. Sensations of itching, skin sensitivity, or numbness can last several weeks after treatment. These sensations are normal, but instruct the patient to contact you if they worsen over time. Patients may begin to see results in as early as 3 weeks, but will experience the most dramatic results between 1 and 3 months. Bring the patient back after 30 days for a follow-up medical assessment to review the results, reassess, and determine if additional treatments are needed. Treatment of the abdomen may take more than one treatment session, so set expectations with your patient during the consultation. With a variety of applicators, the Cool Sculpting System allows you to create customized treatment plans to fit the individual needs of your patients. The Cool Max, Cool Core, and Cool Fit applicators are preferred for treatment of the abdomen. When marking the patient, remember to look for the natural shape of the body. Identify where you will debulk versus sculpt. Mark the peaks of the abdomen with an X. Find the natural orientation. Center the template over the peak of the bulge. Mark the treatment area using different color pens. Take a step back to confirm full coverage. Seat the patient in a reclined position and apply the applicator. Immediately after cooling ends, administer a 2-minute manual massage. To make the Cool Sculpting procedure successful in your practice, properly educate patients on what they can expect during and after treatment. Deliver transformational results by performing a 360-degree assessment and developing a customized treatment plan. Provide the patient with a positive experience by creating a relaxed and welcoming environment. Stay tuned. At the end of this video, we will show you examples of how to assess different body types to debulk and sculpt the abdomen on both male and female patients. Thank you for partnering with us. We look forward to helping you make the cool sculpting procedure a success in your practice. Results and patient experiences may vary. During the procedure, the patient may experience deep pulling, tugging, pinching, numbness, or discomfort. Following the procedure, typical side effects include temporary numbness, redness, swelling, bruising, firmness, tingling, stinging, and pain. Rare side effects may also occur. The cool sculpting procedure is not for everyone. Patients should not have the cool sculpting procedure if they suffer from cryoglobulinemia or paroxysmal cold hemoglobinuria. The cool sculpting procedure is not a treatment for obesity. As with any medical procedure, a consultation should be done by a licensed physician to determine if the patient is a candidate for treatment. Consult the Cool Sculpting System user manual for a complete list of contraindications and potential side effects. Treatment applications that deviate from the guidelines are not recommended.